Did you just have ACL reconstruction surgery and you're having trouble working on your range of motion, or you feel stuck, you're not making improvements? We're going to go over one simple technique to really help improve your range of motion. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. All right, so let's just jump into it. So one of the biggest questions we get asked all the time from our clients that are about to have surgery or people online is, how do I improve my range of motion quickly? Or the people that are having trouble is like, how do I get past these sticky points? So we're gonna go over one simple technique that we've seen with our clients work, and that's usually going in little bouts. So the thing that we often see all the time is that people say like, hey, I'm working on my range of motion exercises 1 hour each day, maybe even twice a day for 1 hour each. And that's the problem. So the thing is, after ACL surgery, your knee is very irritable. There's some swelling. And the biggest thing it doesn't want to be having is having too much exercises. That's what causes more swelling. So we normally tell people, instead of doing that 1 to 2 hours at a time, break it up into several little bouts. And we're gonna go over examples. So normally I usually tell people, if you have 1 hour time throughout the day that you're gonna do your exercise, instead of doing it all in 1 hour, which people like to do, so like, hey, let me just get it over with. Early on, it's best to go maybe 5 to 10 minute bouts several times throughout the day that equate to an hour. The reason is that if you do that hour, your knee might just swell up and cause more stiffness. And that's what usually people tell me, that, hey, I did it for an hour, my knee felt stiffer than before doing these mobility exercises. And that's because the knee just can't handle all that early on. So we're gonna give you an example on working on flexion and extension. So when we talk about flexion, is meaning just bending your knee. The biggest thing is, like we talked about, instead of focusing on that full hour working that range of motion, let's take little bouts, 5 to 10 minute bouts. And we're gonna give you different examples. So one example is maybe potentially the heel slides, where you're sitting down and you're just pulling your knee towards you and then slowly letting it go. Or using the wall slide, so your feet are against the wall and you're letting gravity just bring it down. Or even using just sitting off the edge of the table and just bringing your leg, bending your knee. Or even using the stationary bike, just going half revolutions, slowly working your way to full revolution. Choose any one of those and just do it for 5 to 10 minutes several times throughout the day, and you'll see better results than doing all these in one bout. Or you can choose maybe whatever one that you like. Let's say you like the wall slides more than the heel slides. That's okay. Just find one that you like and you feel like you're improving your range of motion, and try to do that for those 5 to 10 minutes, and then switch over, take a break, and then later on during the day, do another 5 to 10 minutes. The big thing is you want to get through these range of motion exercises with minimal pain, and your knee should be feeling good after you're doing it, as opposed to when you do a whole 1 hour session, your knee just might feel stiff and just worn out and just swollen just because you just did too much and you're gonna have to ice it. So that's the example on flexion, bending your knee. With the extension, that's a little bit harder. So this one's a little different, that I would actually recommend a prolonged hold when you're just going in this position where we're working on extension. So when we do this extension motion where we have our leg propped up and we have a little weight on the front part of our knee, and we're focusing on stretching out the back of the knee, getting that full extension, those I do recommend for that 8 to 10 minutes, 12-minute long duration holds. Those are the only ones that I recommend holding for longer, because we want that phenomenon where we're really stretching out that posterior capsule when we try to get our knee straight. So that's the only one that I would recommend for a prolonged period of time, but that's still less than 20 minutes. So once we do that one, we have that option, or we have options of stretching out our hamstring, stretching out our calf, all muscles that incorporate getting that knee straight. But with the extension, like I mentioned, I would still do several bouts. So if you do the extension holds for 8 to 10 minutes, maybe 12 minutes, then take a break later on in the day, do it again, and then take a break later on, do it a day, as opposed to just doing it once. You want, especially early on, get the knee moving several times throughout the day, little bouts, but these little bouts are gonna be huge in allowing that first 2 weeks to be the easiest part of your recovery, because if you don't, it's gonna set you back and it's gonna affect the way you're walking and affect your overall recovery. But those are some of the examples that we kind of talked about with improving range of motion. Big thing is really focus on these little bouts throughout the day. And if you need to focus on flexion and extension, maybe you do flexion, take a break, later on in the day you do extension. So you can mix and match both of them. You don't have to just work on just extension one day, flexion another day. You can do flexion, extension, but little bouts. Just choose one, 5 to 10 minutes max, and do that throughout the day for a total of 1 hour. And that's going to give you more results than 1 hour of just doing range of motion exercises. If you guys have questions about this idea, or if you guys want us to go into further detail, comment below. We'll make a video based on that, and share this video with other people that are having problems getting their range of motion, and subscribe to our channel. We are the Basketball Doctors. Let's ball for life.